host Dr. Robert Bouvier with Doctor and You, and I've got a friend of mine here in patient, and we're going to talk a little bit about the Accountable Care Act, and he's going to talk about as one of the casualties of the Accountable Care Act. So you had insurance, you were doing pretty good, and you changed jobs, and they didn't offer insurance, so now you go try to buy it yourself, and you know it was.
Well, it jumped substantially. What the cost was for my wife and I for the lowest plan,
The bronze
plan, and the deductibles were crazy stupid high, $7,500 a piece.
Yeah. Right.
And the plans are written in such a way that no copay that you make counts towards your deductible.
Okay.
So it's strictly out of pocket, no copays, $7,500. So I could be up to $20,000 or more a year that would I be paying before I would receive 1 red cent in insurance coverage.
So how much was the cheapest bronze plan you could find?
The cheapest one that had even a higher deductible was $878 and change.
Okay.
But it had a $11,000 something deductible per person.
Okay.
$11,500 I think
Right.
it was per person.
And so as an alternative, you've talked with people, and you talked with, you heard about this other alternative. Yeah. So tell me a little bit about that alternative.
There are several of them that do this. Each plan's a little different, or each organization is a little different. We've settled on an organization called Samaritan's Ministries. It's a sharing of expenses.
Okay.
There were religious organization exemptions in the ACA.
Right. Accountable Care Act.
Yeah.
A.C.A. Obamacare. It's also called the Affordable Care Act, but it is the ACA, Accountable Care Act.
And what this is, it's a sharing of expenses. And there's a clearinghouse organization, and every month you send money not to the organization, but you receive an email telling you whom within the group has a need that month, and you send your, with my wife and I think it's either $364 or $367 a month that we would send to that person to help them with their medical costs.
Okay.
There are upsides and downsides. Downsides, none of them cover pre-existing conditions.
Right.
So if you're somebody with something chronic like me, that's not going to be covered. But we're using it more as a catastrophic illness
plan.
Yeah, illness or injury plan.
Now, do you still have to pay the penalty?
No.
In your taxes the next year?
No.
So how does that work?
Once you are accepted by it, you receive a form, and it's I don't remember the number of it, but it's a federal form.
Right.
And it's certified by the organization, and you file that with your taxes. Then, so for 2015, I'd file it in 2016 with my taxes, and that shows that I'm exempt from having to be a part of the ACA.
So another example of the Accountable Care Act, probably the not so good example as far as being affordable, but actually a casualty of the Accountable Care Act. And to be on the other side, you've got friends who probably aren't working and probably qualify, and for that same thing you were going to pay $1,200 for a month, they get it for $100 a month.
They get subsidies, and we know folks that are getting silver, and even a couple of people with gold level plans. They're paying next to nothing for them, but they're not working.
Right. So there's casualties on both sides, actually.
Yes.
And so just a little more information about the Accountable Care Act and things to look out for. And this blog is primarily for that. So anybody with any questions, again, give us a call. This is Dr. Robert Bouvier with Michigan IPA. You have a great day.